Hello and welcome to Specialist Speaks. I'm Dr. Divya, consultant plastic surgeon at Specialist Hospital, Kochi. Today we have with us Dr. Jayakumar, head of the Department of Plastic, Reconstructive, Microvascular and Cosmetic Surgery at Specialist Hospital. This podcast series aims at simplifying complex medical topics for the common man. Today we are going to discuss rhinoplasty, or what is commonly known as a nose job. Welcome, sir, to Specialist Speaks.
Thank you, Divya. Glad to be here.
So, what essentially is a rhinoplasty? Is it just a beauty procedure or is there more to it?
It's a very good question because a rhinoplasty surgeon should address both the beauty part, that is a cosmetic part, and also the function of the nose. To clarify or make it more clear, many a time a patient comes with a crooked nose. So the nose is crooked, he or she is bothered about the appearance, but almost always these patients will have obstruction of the nose, which causes repeated respiratory infections. So the rhinoplasty surgeon will address both the cosmetic part and also the functional part where the airway obstruction is relieved. So actually, a rhinoplasty is correction of both form and function.
Yes, sir. And how do you get this new shape? How do you sculpt the nose? Are there materials you put in? What do you do? How do you get the shape?
When we sculpt the nose, what we are actually doing is we alter the skeletal structure of the nose. There is very little bone in the nose. Most of the skeletal framework of the nose is made up of cartilage. So what we really do is sculpt the cartilage to alter the shape of the nose. Now, many a time, the cartilage of the nose, inside the nose is insufficient, and we will harvest cartilage from the ear or from the rib. Some surgeons also use synthetic material like silicone. We in our center do not use any synthetic material. We use the person's own cartilage. There's a big advantage in using your own cartilage because you don't have to worry about anything later. You don't have to take any special care. You can do the procedure and forget it. Whereas if you put in synthetic material, you have to take a lot of care. It can get rejected, and problems like that are there when you use synthetic materials.
Okay, sir. In your long and illustrious career spanning over 35 years, how many such procedures have you performed, roughly?
Maybe well over 1,000 cases. As you know, Divya, we conduct a rhinoplasty course for teaching surgeons rhinoplasty, and we have been doing it for more than 25 years, which is possibly the longest running continuing rhinoplasty course in the country.
That's very encouraging for young plastic surgeons like me. So, sir, when a patient walks into your OP who wants to undergo a rhinoplasty, how do you assess if this patient is a candidate for rhinoplasty?
This is a very, very important question. Now, we do rhinoplasty or most cosmetic procedures only on an adult person. Why an adult? Because it is important that the person is mature enough to decide whether he or she requires or needs a rhinoplasty. It is very important for the individual himself to decide whether you require that surgery.
So beyond the cosmetic indications, what are the common functional indications that you perform a rhinoplasty commonly for?
Divya, as you know, almost often it's a combination. Some of the indications are, a common indication is a crooked nose. The usual cause of crooked nose is some kind of trauma. You may have played cricket, a cricket ball would have hit against the nose, or you may have fallen down while going on a bicycle. There could be innumerable number of causes which caused a crooked nose. Another common indication is a hump in the nose. Sometimes, especially in South India, you want more definition for the tip. The tip of the nose becomes bulbous, or the nostrils flare out. Sometimes you have a depressed nose, which is called as a saddle nose. So you want to make the nose more prominent. Sometimes the nose is too big. You want to make it short. So these are some of the common indications. Then another large number of or many patients come who are born with deformities. For example, cleft lip. Children 1 in 800 children are born with cleft lips. Almost all of them require a rhinoplasty. So these are some of the common indications for a rhinoplasty.
Given that we are in the era of social media, how does a patient ensure that a particular surgeon is qualified and competent to do this particular surgery?
This is very important important today. Now, I think one must understand that rhinoplasty is serious surgery. So one should, before going in for rhinoplasty, one should ensure that the surgeon is well trained and experienced. Now, let me just take you through the process of the training of a plastic surgeon. To be a plastic surgeon, one must do about 5.5 years of MBBS. Following that, he or she must do his master's in surgery, which takes another 3 years. Then one has to do his master's in plastic surgery. That's another 3 years. That's almost 12 years. After that, you need to do fellowships to train in specialized procedures like rhinoplasty to do proper, good rhinoplasty surgery.
I'm sure that's very informative to our listeners. Now, something that everybody is curious to know, how much does this procedure actually cost?
Okay, Divya, you know that this is surgery. It's not like going and buying something from a shop. But as a general rule, I'd say it will cost anything between a little more than ₹1,00,000 to about 2.5 lakhs. But it depends on the procedure, depends on the degree of difficulty, and depends on what we really need to do for that particular patient.
Now, here's a fun one. Have you ever had that odd patient who walks into your cabin with a photo in their hand of a particular celebrity wanting for the exact same nose? And how do you deal with it? Is it even possible?
Yeah, of course. I mean, we all know that you have the occasional patient walking in with the photograph of a celebrity telling you that I want this exact nose. This is science fiction. This is really not possible. You cannot transplant somebody else's nose onto a different individual.
Okay, so now suppose we have selected a particular patient for this procedure. What kind of preparation does the patient undergo? What is the downtime we are looking at? What is the post-op recovery? Will there be a dressing? Will there be a splint on their face? Can they step out in public? How soon can they do this?
Again, like any other surgery, we need to evaluate the patient, whether the patient is suffering from any other diseases like blood pressure, diabetes, etc. Which, if it is there, we keep it under control before patient is taken up for surgery. Then after surgery, the patient usually is able to leave the hospital in a day or two. And when the patient leaves the hospital, the patient will have a splint on the nose, which we will leave on for about a week to 10 days. And after 10 days, the splint is removed. We do not advocate the patient to wear a splint after that. He can get back to normal life after about 10 days. However, we would advise him not to get into contact sports or go to the gym for about 1.5 months. Otherwise, there are not many restrictions.
Like you said, rhinoplasty is serious surgery, but it is safe in the right hands. Having said that, what are the complications that one can expect in the rarest case?
Yes, this is important. Again, the rhinoplasty is a very, very safe procedure in skilled hands. However, this is like any other surgery. Complications, things can go wrong and complications can happen, but this is rare.
Something that I get asked quite often is, does having facial structure altered, like nose, affect facial recognition and the identity of the patient? Have your patients expressed any such concerns?
Not really. It really does not change the identity, but it generally makes you look much better. In fact, many a time, and it's important when you do surgery, that a third person should not feel that a surgery has been done. You generally appear more attractive.
We are in the era of quick fixes. Is there any role for Botox, fillers with respect to the reshaping of the nose? Okay,
good that you asked me that question. There is a procedure called liquid rhinoplasty where fillers, a synthetic material, is injected to the nose to alter the shape. This one must understand that this by these kinds of procedures where a filler is injected, where you call it liquid rhinoplasty, it is not really a rhinoplasty. Yes, you will have changes. These are minimal changes, and one must clearly understand that these changes are temporary. And moreover, one of the problems is repeated injections like this can scar the nose and make scar inside the nose, not outside. You can scar inside the nose and make proper rhinoplasty procedures more difficult. So yes, there is a procedure called liquid rhinoplasty. It makes small changes to the nose.
So in your experience, are there any interesting stories where rhinoplasty has been life-altering for somebody?
If I look back, maybe I can give you an interesting story where a lady who was 50 plus came to do a rhinoplasty. So at the time of consultation, she told me that she has been wanting to do a rhinoplasty since she was 18, but didn't have the courage and finally gathered the courage to do this rhinoplasty. Now, after the rhinoplasty, she was so happy that she encouraged her son, who was training to be a doctor, he was doing his MBBS, to train to be a plastic surgeon. And after many years, this boy, who became a plastic surgeon, spent some time with us. And during that time, he told me the story of his mother having had a rhinoplasty with us. Now, another interesting thing I think I should tell you, I really enjoy looking at a patient or looking at a patient's face when he sees his face first time after he removes the splint. Because the joy that you see on a patient's face when he or she looks at his nose, I've never seen with any other kind of surgery, including life-saving surgery. So I know this rhinoplasty brings in a lot of emotions.
Thank you so much, sir. That was an insightful conversation. I am sure our listeners are much more educated and aware about rhinoplasty.
Thank you for having me.
To our listeners, until next time, stay healthy, stay informed. Thank you.